People with hypochondria are unable to control their fears and believe they have a serious illness and pay excessive attention to health. Dr. Dan Blocker, Director of Behavioral Medicine at Pomona Valley Hospital Medical Center, reveals a new term for hypochondria and defines the condition.
It actually has a new name now. It's illness anxiety disorder or health anxiety. And what it means is that you are distressed and overwhelmed with consuming thoughts regarding illness that you don't actually have. For example, if I was to tell you to focus on the color red and you were to walk outside, the color red would pop up more. So for patients who begin to worry about symptoms, they begin to notice more and more and more until it becomes all they see.
Dr. Blocker discusses who is at risk.
Illness anxiety disorder affects 4 to 6% of the American population. It affects men and women equally. Comorbidities for illness anxiety disorder include anxiety, depression, panic disorder, and OCD. Other things that can impact or can predispose you to this are things like an abuse history, other kinds of trauma, things that may put you in a risk for other types of anxiety.
Dr. Blocker outlines treatment options for health anxiety.
There's a few things that have to happen for it to be treated effectively. Best practices include CBT or cognitive behavioral therapy, as well as mindfulness or relaxation therapy, where you work with and help them learn ways to naturally bring down their anxiety. Medication, in particular SSRIs, can be very helpful. Things like Zoloft and other kinds of medication like in that family. Finally, a partnership with your doctor. This is the most important part. Working with the doctor to have regular scheduled appointments, because some of the most important complications that can happen with hypochondria or illness anxiety disorder are going to be results of over-testing, complications from exposure to the x-ray machine, things like that. And so by working with the doctor on a regular basis, you can reduce the likelihood of that and reduce the complications that can come from that. CBT, or cognitive behavioral therapy, is the most researched and most validated way of treating and addressing this. Family therapy is also important. With cognitive behavioral therapy, with medication, with the support of your doctor, improvements have been shown. The reality is that the anxiety may always be there, but we can quiet it down. So instead of just focusing on that color red, you're able to see all the colors and be able to go about your day like everyone else.